Welcome back. Well, pain and pressure in your chest caused by heartburn can sometimes feel like the pain of a heart attack, but knowing the difference could save your life. So joining us this morning from Gundersen Health System to discuss how you can tell the difference is Dr. Michael Witcik. So thanks so much for getting up with us.
Good morning.
So first of all, let's talk about heartburn and what are the differences comparing that to a heart attack?
Well, heartburn classically may start a little bit lower in the chest and then work its way up towards the mouth, even having an acid taste in the mouth. And, this might be similar to something they had previously, whereas a heart attack would come on at rest, could be a severe pain in the chest, and might be associated with some other symptoms like shortness of breath, lightheadedness, sweating. Also with heartburn, it also might occur after a large meal or laying down. So these can be difficult to differentiate, as you say, but they do have some classic findings as well.
And in such a stressful situation when the symptoms are actually presenting themselves and somebody's maybe deciding between one or the two, what do you recommend? Do you recommend that they more or less, take it as it could be a heart attack and come in, or what do you recommend?
I think if somebody's had it before, they can use it as a guide. But if it's a new symptom, I think the safest thing would be to come be evaluated because, like we said, it can be very difficult to differentiate these just based on how people feel. And we see lots of times people think this is just heartburn. It does turn out to be a significant heart attack. So it's important to be evaluated by a healthcare provider for sure.
And being evaluated by a healthcare provider, how can that really help? I know sometimes a lot of the time with heart attacks, minutes matter most in this circumstance.
Yeah, and that's very true. So what we would do is have you come into either your regular provider or even the emergency department, and we do act quickly in these situations, and we start getting tests that help decide between these two diseases. So we get an EKG and some lab work, and that helps us differentiate which of these two diseases may be occurring at that moment.
And with heartburn, are there some over-the-counter medications that could be prescribed as well as coming into the doctor and getting something there?
Definitely. So if you have a known diagnosis of heartburn, a lot of the over-the-counter remedies work quite well. And these include acid suppressants, such simple things such as Tums or other drugs such as Prilosec, and a plethora of other things that are available over the counter. But if this is a new diagnosis or a new symptom for you, it's probably best that you be evaluated by a healthcare professional.
All right. Well, thank you so much for joining us this morning. The bottom line is if it's a first-time symptom, it's probably best to come in and get checked out. Better to be safe than sorry. Well, thank you so much.